Welcome to our show. You're listening to Palm Beach Music Therapy Connections, a place to learn about and celebrate creative arts therapy. Each week we'll explore new ways that music, art, and dance can reach, connect with, and help individuals of all stages of health and wellness. Hi, I'm Bree Bynan, a board-certified music therapist and the managing partner for the Palm Beach Music Therapy Institute. Tune in as I interview professionals from healthcare and educational backgrounds on the impact of the creative arts. If you prefer to watch our live video stream, simply visit www.pbmti.com. Hello, thank you so much for listening tonight. You have joined us at Palm Beach Music Therapy Connections. I'm your host, Bree Bynan, board-certified music therapist and neurologic music therapist, here locally in South Florida with the Palm Beach Music Therapy Institute. If this is your first time joining our program, the next hour is devoted to shining a light on creative ways to approach healthcare and education challenges and finding solutions. So we talk to a lot of creative arts therapists on this program, music therapists, art therapists, dance and movement, and anyone who's really out in the community thinking a little bit outside the box to find ways to reach, connect, and communicate with others. I am thrilled on many, many levels to be able to introduce our guest today. One of them being one of our very own music therapists here at the Palm Beach Music Therapy Institute, a good friend of mine and frankly just one of my favorite human beings of all time, Trenton Barrick, board-certified music therapist and also certified neurologic music therapist. And we're going to be talking about his work at Memorial Regional Hospital, specifically the rehab unit down in Hollywood, Florida. So again, locally working here in South Florida. Thrilled also to be talking to someone he works very closely with, Dr. Lauren Thomas, who is the director of the neuropsychology rehabilitation. I've been practicing that one. This big, long title. She's going to tell you all about exactly what that means in just a few moments. I usually take this time to share some thoughts on the things that we're going to be talking about today. I'm going to keep it short because there's a lot of information that I want to share, that I want to give Trent and Dr. Thomas a chance to share. And probably selfishly, what I'm most excited about at the end is a chance to share some music with my friend Trent. So I hope you stay around for that. The last 15 minutes, we're just going to jam and have a really good time. And hopefully it's some songs that you're familiar with so you're able to sing along and enjoy with us. If you have been listening to this program, you know that this is a topic that is very close to my heart, not only as it's the work that I do as well, but just something I'm very passionate about working with individuals who are coping with neurodegenerative disorders like Alzheimer's, Parkinson's, stroke survivors, ALS, and Trent's going to talk in detail about a lot of the work that he does with all these populations as well as TBI survivors. And the very first show that we ever did for Connections was talking to the authors of the book Allison's Brain. This was Allison Woyawada and her partner, Dr. Robert McMecken, were down here I think they're snowbirds locally here in South Florida, but also from Ontario, Canada. And they have written a story about Allison's journey after suffering a neuro accident and her journey back to speech, her journey back to health. And she attributes a lot of that to working with a music therapist. So they came and talked about their journey together, how Dr. McMecken's role as a caregiver supporting Allison through this. And she actually was here to give the interview, which speaks volumes in itself, how far she has come in her recovery and her rehabilitation. And again, attributing a lot of that to the neurologic music therapist that she worked with. So if you did listen to that show back in October or maybe end of September, the first show that we did, you're going to be familiar with this topic today. If you didn't, you may be familiar with the idea of music therapy being a part of the speech rehab process if you have followed Congresswoman Gabrielle Gifford's story at all, who suffered a gunshot wound to the head, which affected her speech center. And again, she attributes a lot of her success in her speech rehab process to working with a neurologic music therapist, starting with singing familiar songs and transitioning that to functional speech. And one of the biggest stories that's kind of made it to media is the fact that she was able to communicate "I love you" to her husband for the first time since the accident during a music therapy session, which is some incredibly powerful stuff. So without further ado, because I want to get right into the meat of what we're talking about today, I want to introduce you to, again, I can't say enough wonderful things about him, Trent Barrick. Thank you so much for being here today.
Thank you.
Coming up all the way from Broward County, really appreciate it. So, Trent, can you just give us a little bit of background about how you got involved with music therapy? What brought you into this field?
Sure. I was at a crossroads in college because I had to choose between marching band and being an RA, and I chose to be an RA. And so with that came a list of classes that I could take what would fit as lifestyle with an RA, resident assistant. Music therapy seemed to be the best fit. And then I got to thinking, gosh, if I pursued marching band, I would be a music education major. I'm not an educator. I'm really a therapist at heart. I want to be with people. And from there, I just you always getting your feet wet a little bit, in therapy. So we got to do the intro to therapy courses, just opening one door at a time, and really it's like the onion effect, pulling back layer by layer to see that therapy really matched who I was, and really brought out my altruism in a way that I've never seen before, that I didn't think education could. And so I pursued that route, finished my degree, got my degree in music therapy from an accredited university, University of Louisville. Go Cards.
Yeah, sorry.
I know, postseason band. We won't talk about it. But from that place, my director encouraged me to find an internship. We have to complete a 6-month internship as well as a board certification. And she encouraged me to go out of state. A lot of Kentuckians like to stay native, like to stay within the realms. But she saw something, on me. She was like, "You got to go. This is your chance to go and explore." And I said, "Let's do it." And so I applied to all kinds of internships, but the only one I felt peace on was hospice of Palm Beach County and West Palm Beach. And so I came. And
another now Trustbridge alum.
Now Trustbridge alum.
Half the people on my show.
You got it. Yeah, it's a great training ground. Yep. It super is. And I've had 5 good years at Trustbridge under some great supervision, and of course the patients. That's what kept me around for sure. Mm-hmm. Yeah.
And so, just in case anyone is listening who is maybe not so familiar with the field itself, can you just share a little bit about what you mean by, I didn't feel called to go into educating, but I felt like music therapy was more appropriate?
Sure. So, with therapy, music therapy is basically using music in an allied health profession, one that's basically partnering with the patient, developing a relationship, a rapport, and from that place, developing goals and objectives. Depending on whatever the patient might be going through, it could be for symptom management, it could be for, in this case, rehab, gaining independence back, in the setting that I'm currently in. But it's basically using music to facilitate change. As compared to education, which is a teaching music, breaking down the constructs of music for someone to kind of grasp a concept, if that will, and then be able to, of course, re-educate someone else. So if that's, I would love your insight on the differences between the two.
I'm the interviewer here, okay? No, that was perfect. That was perfect.
Great.
So like we mentioned, we're fortunate enough to not only start with our internship, but start our careers in hospice care, and have had such a wonderful opportunity to have you come on over and join us at PBMTI to really just start this program together.
Sure.
This was the focus of coming over here. So can you share a little bit about what specifically NMT or neurologic music therapy is, and why it was so important to learn that section of the music therapy world for this position?
Sure. I jumped ship, if you will, from hospice directly into the rehab setting, and so it required a different set of skills. And neurologic music therapy, NMT, is basically a research-based system of standardized clinical techniques that specifically addresses sensory motor training, cognitive training, speech and language training for a brain that has been affected by a disease or has encountered some type of injury, nervous system as well, disease or injury. And it's basically using music rather than like a music does carry socio-cultural values inherently. But instead of letting that be the prime focus of the session, I'm using music to influence brain functioning, right? And so I'm using music as the brain's language and trying to engage as much of the brain as possible in order to elicit some type of specific response. So it's a little different than hospice.
Right? Yeah,
Very much
absolutely.
so.
How do you feel like your experience in the hospice setting kind of
Oh gosh.
prepared you for this?
Well, I think when you first met me, I was known for being the intern that said baller a lot. Wow, that's baller.
Oh yeah, I was one of your supervisors. I remember.
Yeah. I don't think I said it in a session, but there was just some quirks I had coming out of college as a young professional that I had yet to iron out. And during the internship, I still wasn't completely ironed out. I think at one point you guys gave up on me and said, that's just him, let him be. Send him down the Broward, let him go, under the radar, let him just do what he
There were a
wants to
few
do.
sessions that never mind.
Yeah.
Continue.
We have great stories, great memories.
Stories.
And truly, the experiences that I got, as a blossoming professional, just came from risk and failure. What worked, what didn't work in a session, what worked for a specific family, what conversation, what words did I use for a loved one in grieving, was not the most effective compared to another family. The right word was just kind of spoken, and not to heal grief, but just at least be the comforting presence I needed to be within that therapeutic process, for sure. And so all the experiences kind of wrapped up, including learning repertoire after repertoire for probably thousands of people over 5 years. I got to transition all of that with me, transfer it all to this new placement, to where I honestly rolled in. I probably look like a rock star, but really it's just I had done a lot of work in the hidden place, in the secret place, that I was just kind of able to bring into the light on the first day, and I've loved every minute of it.
And literally the first day.
The first day.
The first day.
So crazy. There's a book that, of course, I can't remember the title of it. Great, I'm on air. But it basically speaks about some of the first things in the first 90 days. Bam, got it. The first 90 days, one of the things that it speaks about is early wins. And I was just so fortunate to be at the right place at the right time. Got into the hospital. They asked me to do a quick presentation for the entire staff.
Yeah.
I had no idea. They're like, oh, just do a 15-minute presentation and we'll all be listening. And I'm like, oh, that's great. And I get in there. It's physicians, it's nurses, it's therapists. I wasn't prepared, but I was solid. It was fun. And so I got to present over the benefits of music therapy. I was saying, oh, it decreases blood pressure. It decreases agitation, pain, anxiety, and it increases, has the capability of increasing cadence or gait, walking distance. And so a PT heard that, remembered that. The next hour, she had a patient. She grabbed me. She was like, oh, Trenton, all your claims, let's see how they work. And of course, I'm sweating bullets at this point because I'm thinking, oh, it works for everybody else. I hope, I just hope it works for me too. And the patient had carbon monoxide poisoning that we got to visit. She could not communicate non-verbally or verbally. She had worked with the PT the prior day and only been able to walk about 6 meters total. And that was with the PT verbatim saying I literally tried everything I knew possible. And so she incorporated me into her session. And I observed the client, kind of creating a baseline. Where's this client at? Assessing how can music work? Assessing her cultural background. Okay, she's Cuban. All right, great, Cuban. Let's go for something really strong, really rhythmic. Guantanamera. It probably works. It's super repetitive, so of course it's going to be in every person's head after at least 2 minutes, right? And she walked with us 75 meters just within one session, to everybody's surprise, to my own surprise. My first day on the job, I couldn't be more thankful to be in that position. And of course, everybody within 10 minutes heard and filming, and I got a lot of cool emails that were super supportive, and since then it's just been such a walk on air, almost like an ease.
It set the stage.
It seriously
I
did.
mean, I'll always remember that day.
Yeah.
Yeah.
But then I came back the next day. I was like, oh God, what am I going to do now? I was like, what?
The bar is very high.
The bar's set. Like,
Yeah.
what am I going to do?
Yep.
But things just popped. I just seemed to be in the right place at the right time, and music really took its own ability and went from there. And the brain responded in beautiful ways that none of us could ever have guessed. We were all super surprised. So
It was the perfect situation for backing up what you had just talked about, right? For all those people, yeah, really, it was.
Sure.
It really was.
Sure.
We're going to dive in a little bit more about specifically what you do, the clients you work with, how you reach
Yeah.
them, after a quick word from our sponsors. Stick around.
Mom's fall was a wake-up call. We knew she needed help, but we also knew she'd never leave her home.
With jobs and kids, we can't always be there. We weren't sure who to trust to help around the house and make sure she takes her medications.
We did our research and found our answer, Bright Star Care. Their home care teams are led by registered nurses, with help available 24/7.
Thanks to Bright Star Care, Mom can stay where she wants to be, at home.
For a standard of care that raises the bar, call 844 for Bright Star.
The Palm Beach Music Therapy Institute is a professional music therapy practice serving medical, community, and educational settings throughout Southeast Florida. With our experienced team of 11 board-certified music therapists, we use music and research-based therapeutic interventions to help individuals of all ages and abilities reach their goals and increase their quality of life. For more information on our services and programs, please visit our website at pbmti.com. Engage with us on Facebook, Twitter, or Instagram, or call us at 561-747-9944. You are listening to Palm Beach Music Therapy Connections. If you'd like to join the conversation, the toll-free number is 888-565-1470. Now back to the show. Thank you so much for joining us. You're listening to and watching Palm Beach Music Therapy Connections. I'm your host, Bree Bynan, and I am here talking with one of our very own PBMTI music therapists, Trent Barrick. So wonderful to have you, Trent. I pulled Trent on a little earlier to just kind of start introducing us to what his background is, how he came into the field of music therapy, and kind of his professional transition from working in hospice care to now working in rehabilitation. So we talked a little bit about NMT and the importance of that, the difference that having that distinction of a neurologic music therapist makes. And right before the break, started to talk about your very first day.
yeah.
We're setting up this brand new program, which had been talked about in the works and birthed out of an elevator conversation that I had had almost a year to the day from when it started prior, just because the world is amazing and
Yeah.
works in amazing ways.
True.
So what has that experience been like? Because that was a brand new experience of starting a new program
Sure.
and introducing it to all the different disciplines that you
Yeah.
work with. So to walk us through that a little bit.
My first step was learning everybody's name, and as easy as that might sound, I really worked hard to do. What are those things where you have analogies or
Is it-
associations?
Oh, yeah.
Associations. So I would see Bree and blonde for Bree, and so I would have that for each person. Lovely Lauren, I'm a charmer, right? And so using those associations, even learning someone's name, I saw really help build respect super, super quick. And even rapport with the clinicians, because ultimately, I'm a contractor. I have 25 hours that the hospital has given me as a music therapist. Realistically, I'm not going to have a whole lot of time to kind of branch out on my own to figure out how things work and to figure out how can I really make the best impact with these patients, because within the rehab setting, each patient has to meet 3 hours of exercise a day, and that's only through a reimbursable therapy such as occupational, speech, or physical therapy. So music therapy doesn't fall into that specific category. And so who's
Not yet.
not yet, but we will. So who's my gateways. Who's my gateways? And they're the clinicians. They're neuropsych. They're PTs, OT, speech. So the closer I am with people, the more I'm going to be able to kind of show them what I can do, but also I can get a feel for what do you need from me? What are you doing? What do you need help with? Are you having a hard patient? Let me join you. If you're having an agitated patient that's just, cussing up a storm and, making you have a hard day, I love just to see what I could possibly do just to turn that around, because ultimately it's helpful for the patient's relationship with the therapist or with the clinician. So I'm all about being a team player, and that's what I think Memorial shines at, is everybody's just in it to win it.
I think that's integral, especially, in any setting, but especially in this setting, and especially when you're a new modality coming in and saying, hey, I'm not trying to compete with anyone or whatever. We want to, this is only going to be successful if we work together.
Definitely.
I know we'll get a little bit more into this later, but just from the few times that I've gotten to come down and be a part of the process, is some of probably the most memorable days that I will have or have had as a clinician. The young gentleman that we were working with, and the OT would just come to you and say, hey, he's having issues with identifying colors. What are you going to do about that, Trent?
I'm going to say, I too am colorblind. That's how I feel you.
In that moment, we had a red tambourine as a goal, a yellow tambourine as a goal. We had the different boom whackers that are different colors. And it didn't take you 30 seconds to come up with some of that. So would you mind just sharing a few of the many, I'm sure you're doing this every day, creative approaches that you come up with?
Yeah, it is a constant reassessing of what's working, what's not, and depending on the patient's goals, it could be cognition, it could be memory, it could be sequencing. With the color identifications, normally we'll set up various drums with or boom whackers, each one having a different color, and then asking the patient to maybe cross over. If he has a weakened arm, we'll ask him to help his weakened arm with a strong arm and go for that specific color or go for that specific sequence. So going red, blue, yellow, yellow, blue, red, adding to the difficulty, red, red, blue, yellow, just seeing what's the threshold. And then reassessing from that, documenting, of course, this is his progress. Let's see if he's able to maintain that consistently. Instruments provide such an array of creativity. I feel like for the music therapist, just having your hand in, just having the availability of different instruments can really make your music therapist shine. Of course, we all know how to work with what we have. I used keys for shakers once, and it worked. We can use buckets for drums or anything, but we want to represent a professional discipline, right? And so as professionals, we want to have the right gear in place just to keep these quality of life experiences really valuable and meaningful and rememberable for our patients, I think.
How do you notice a change in the environment of the therapeutic setting with music therapy being present?
Yeah. I always see a shift. I always see, whether that's from the patient's perspective or the sigh of relief from the clinician that might have just worked with him and had a kind of a hard experience. I also see a lot of life being brought back into the staff and the clinicians, especially when we're going for upbeat music, as opposed to maybe relaxation, because then they're involved with the patient. They're interacting, communicating in a totally different way without words. They're playing instruments. They're connecting with the patient, and non-verbally, but in a musical sense. There's no real words to describe the connection that they just created between them, and I get to be the facilitator of that. And so it's just definitely a privilege to see. I don't think I've had one person complain about music, which is... I
haven't received any complaints.
I don't think so.
Yeah. No, that's privilege, such a beautiful word to describe that. I absolutely use the same in my work as well.
Yeah.
What are some of the different settings that you work? I know you talked about co-treating with PT, OT, speech, the neuropsych department, but you're doing groups and you're doing individuals. So what are some of the different, where can you be found during the day?
Everywhere, everywhere. I can be found everywhere. In the mornings, you can find me with my girlfriend Liz, the pet therapy dog.
Love Liz.
I
Where's
love Liz.
Liz? Liz was supposed to be on this program with us.
She's just at home sleeping,
All right.
taking care of, she's got to look pretty for the patients,
Yeah. Oh, yeah.
So
She's got a big job.
she sure does. I can be found either interacting with patients individually, because neurologic music therapy, it can be used to complement therapies, but we really stand on our own feet as far as being able to facilitate change to affect the patient's goals towards their own independence. I can be found in groups such as fine motor group, so using the upper extremities such as your fingers, your hands, your wrists, your elbows. I can be found in an endurance group, and a good way to kind of retrain the brain and thinking, oh gosh, I have to do 20 of these bicep curls. I'm like, hey, just make it through one song. And a lot of times they'll end up doing 60, not even thinking about it, because they're so engaged in Tina Turner's Rolling on the River. Of course, why not?
It's perfect.
I had to go there.
We're doing that one later, right? No.
If you want listeners, probably not.
Okay.
But also, I'm involved in some mobility groups, but with Dr. Thomas, who we'll be talking with later, working alongside them in their pain management and wellness groups.
And one of the biggest focuses for NMT is that functional transference of what was completed in the music therapy session,
Sure.
which is lovely. You're having fun, you're smiling, you're singing, that's great. How does that help us in the real world?
Sure.
How have you seen that in your work?
A lot of it has to do with education and what I'm able to communicate to the patient. This is how you can transfer your skills, because it's a beautiful, wonderful thing what happens within a session, but unless they're prepared and it's applied with great techniques, or even fed those techniques over a consistent period of time, which I think the pain management groups and the neuropsych department does really, really well in. And I'm sure she'll get into that a little bit later. But unless that education is present, the carryover most likely will not happen. And so, for instance, I was working with a patient today who I'm always brought in by an OT to say, hey, this patient is super anxious for a wound change. Can you please play some of her favorite Italian music? I'm like, of course. We have a great rapport. And every time I'm there, she's just so engaged, so focused, not even thinking about her wound change or her discomfort or her pain. But the second I leave, I notice that she gets really anxious. And so we've had to work together to really focus on her breathing. Breathing is a huge part of her relaxation protocol. Whenever she gets anxious because she doesn't know who's about to come into the room, I tell her, ma'am, focus on these songs that bring you a lot of peace in the moment. Think of your favorite Italian song. Go through the lyrics. Breathe to the rhythm, and through the nose, out through the mouth. We say, smell the roses, blow out the candle. That's how we kind of teach. So even giving little associations like that to our patients to help them go back into the real world with a new reality, right?
Is family and caregiver education a part of your job as well?
There is caregiver training. I personally am not involved in that aspect quite yet. I have the opportunity to, of course, share how music can be involved in their lives post rehab, going into the outpatient or even using music at home to engage them in some type of symptom management.
Excellent.
Yeah.
You do amazing work
Thank
every
you.
day. I'm proud to be associated with you. I'm so glad you were able to come on and share about that. We're going to keep talking about that, bring on Dr. Thomas to share a little bit more with us, specifically about her department. So stick around just after this few commercials.
Mom's fall was a wake-up call. We knew she needed help, but we also knew she'd never leave her home.
With jobs and kids, we can't always be there. We weren't sure who to trust to help around the house and make sure she takes her medications.
We did our research and found our answer, Bright Star Care. Their home care teams are led by registered nurses, with help available 24/7.
Thanks to Bright Star Care, Mom can stay where she wants to be, at home.
For a standard of care that raises the bar, call Star.
The Palm Beach Music Therapy Institute is a professional music therapy practice serving medical, community, and educational settings throughout Southeast Florida. With our experienced team of 11 board-certified music therapists, we use music and research-based therapeutic interventions to help individuals of all ages and abilities reach their goals and increase their quality of life. For more information on our services and programs, please visit our website at pbmti.com. Engage with us on Facebook, Twitter, or Instagram, or call us at 561-747-9944. You are listening to Palm Beach Music Therapy Connections. If you'd like to join the conversation, the toll-free number is 888-565-1470. Now back to the show. Hello, thank you so much for joining us. You're listening to and watching Palm Beach Music Therapy Connections. I'm your host, Bree Bynan, and I have with us tonight Trent Barrick, board-certified music therapist and neurologic music therapist, here with me at PBMTI, but also working down at Memorial Regional Hospital, down the Rehab Institute, and we just brought on Dr. Lauren Thomas. Thank you so much for being here. Would you just mind starting by sharing what your role at the hospital is, and maybe just a little bit about the rehab unit in general?
Sure, I'd be happy to, and it's a pleasure to be here with you. Thanks for inviting me to come along. So I'm the director of the Rehabilitation Psychology and Neuropsychology Department. We are housed within the Memorial Rehabilitation Institute. As Trent has referenced before, we treat a variety of medical and neurological conditions through our institute. We see everything from spinal cord injury, stroke, traumatic brain injury, orthopedic injury, amputations, complex medical conditions. Our program has just been growing exponentially over the past couple of years. We're the fourth largest rehabilitation facility in the state of Florida. Wow. And my goodness, I think some of our numbers are we have 1,900 admissions a year, about 30,000 outpatient visits annually. We're just growing, and it's so exciting to be able to bring on new programs like music therapy. So my role and my team's role as a rehabilitation neuropsychologist is twofold. We will work with patients in the neuropsychology realm if they're referred for any kind of neurological impairment or injury. So with that, you think your strokes, your traumatic brain injuries, encephalopathy, dementia, and so forth. And our role there is to evaluate and treat the cognitive, emotional, and behavioral functioning within that disease or within that injury. We'll often be guiding the team and family through some of the complex behavioral concerns that you might see in brain injury. And oftentimes we'll be doing cognitive testing to see what a patient can do, not just where their areas of deficits are, but what can they do and how can we optimize on their strengths as they navigate through their rehab journey. In regards to the rehab psychology track of things, this is where we're working more with our orthopedic patients, with patients that have had amputations, spinal cord injury. Sometimes we've been working a lot with organ transplants lately. And in those kind of patients that are referred to our department, we're helping to adjust to disability to help maximize their resiliency and their coping. A lot of times we'll be pulling in families as much as possible because we know that if your support network is functioning well and is healthy, then that helps to optimize the patient's recovery.
For sure.
So we have lots of fun stuff that we do.
Yeah, that's a lot. Yeah, that's a lot going on. So very similar to what Trent and I were talking about, it's important for that teamwork, right? That team approach, like you said, with all that going on, not only with interdisciplinary, but bringing in the family. And I think that maybe as an outsider and just kind of looking at this program and its success from way up here in Palm Beach County, is this relationship between music therapy and the neuropsychology. I didn't see this coming, I was thinking from, our training I was thinking PT, OT, speech, and this was just a really amazing opportunity that was born out of it. So can you talk a little bit to how you utilize music therapy in or utilize Trent?
Absolutely. So many of our goals are similar with patients. We might be coming from different modalities, but a lot of our goals are absolutely similar. So we try to give our patients as many different therapeutic opportunities to achieve these goals, whether it be helping to better manage their pain, improve their coping. Sometimes we just need to give them some good old distraction. Being in a hospital, sometimes our patients are hospitalized for months on end, and bringing in the gift of song, I think, can be so uplifting and healing to a patient. So there's many types of cognitive issues that we'll work on together. You mentioned sometimes working with language activation. You referenced the Congresswoman's recovery experience, and we get to work with patients that are recovering from strokes all the time, and those are some of my most favorite patients to work side by side with Trent. So for example, a patient after a stroke might have aphasia, which means losing the ability to speak. When you bring in music therapy, you're activating different parts of the brain. Oftentimes language is housed in the left hemisphere and music is housed in the right. Sometimes you activate language pathways through that right hemisphere, through those music centers of the brain. And we've been able to see patients start communicating through song, which is just so powerful in helping them to reach their cognitive goals. But it's also so healing and empowering so they're hearing their voice. And we like to try to pull in family as much as possible, because when the family then hears their family members start to sing and to talk, it's just it gives them that hope again. So
Absolutely.
Music therapy has been very instrumental in that.
Instrumental.
Very good. Pun intended.
Very nice. What would you say is one of the biggest, and again, because coming from an outsider perspective and not really necessarily knowing about the department or thinking about that connection, so what would you say is the biggest misconception about the world of psychology and rehabilitation?
Sure. Well, I think there's a lot of misconceptions about psychology in general. Maybe it's the result of some bad TV or pop cultural trends or so forth. But sometimes there's a stigma attached to, if you're seeing a psychologist, that must mean that there's something wrong with you or that you're crazy, right? So a patient will see me on their list of schedule for therapy that day and say, I don't need a shrink. There's nothing wrong with me. So a big part of my job is to educate them about my particular role. Psychologists can work in a lot of different settings, in schools and jails and psychiatric facilities. But our role in a rehab medical setting is to not determine what's wrong with them, to not be analyzing them, but to figure out what their strengths are and help them capitalize on their strengths and use them to the best of their ability. I would say one of my favorite roles that I play is that of what you call maybe editor, right? So I'll tell patients that I'm joining them on their journey through a particular path in life, and they're in just a really challenging chapter. So I'll walk in and a patient will say, Doc, I don't know how I'm going to go on like this. My life's over. I'm in a wheelchair now. And, that's their voice and that's their truth that they're speaking. And I like to, we call it cognitive behavioral therapy, and we'll help to restructure faulty cognition or reframe or quote unquote edit what they're saying and say, okay, that's one way to think about it. But perhaps we can talk about how life is not over, but more so that it's just different now. And how can we conceptualize life in a wheelchair, and how do we get you back to feeling like you? So really my job is to help them feel like themselves again. I'm not really worried about the psychological diagnosis. I'm treating them as a whole person, not just as a medical record number or as a diagnosis.
That makes you wonderful.
Oh gosh.
She's awesome.
Yeah.
All my colleagues get the credit too.
For sure. You're representing a great team.
Yeah,
Yeah, and both of you have shared that of just how the support of your colleagues makes all the difference in the care. Your work centers on the idea of mind over matter. Why is it important for patients who have experienced a traumatic injury to work with a psychologist as part of the rehabilitation program?
So as you recognized, we've talked about that it's so important to have the whole interdisciplinary team approach, to not treat a patient in isolation if they had, for example, a leg amputation. Obviously, we're going to be working on the healing of that residual limb and how to improve their physical functioning and potentially fit them for a prosthetic and get them back towards that path. But it's really important to not only heal just the physical aspect of the recovery, but the mental health aspect of them too. And oftentimes when you really promote and enhance one's coping and stress management, you're going to get better outcomes in the end. You're going to get better physical healing. There's a lot that we forget how much the role of stress and our mental health play in regards to our health. If we're not sleeping well, you better believe it's going to affect recovery. Sure. There's a lot that a psychologist can work on and to improve your sleep hygiene in regards to pain management, Trent and myself work a lot with patients, both individually and in a group setting, to help improve their pain management practice, so that they're not just relying just on medication, but things that they could use at any point in time: guided imagery, diaphragmatic breathing, muscle relaxation. And we certainly know that when we reduce stress, we are promoting better cardiovascular neurological health. So I like to teach people that I don't want you to need me going forward, right? I want to give you the skills so that you can take them forward and you can activate them at any time to help you get through your journey here.
And that was the one day that I was down and you and I had met and I got to sit in on some of your programs. That was a big takeaway for me, is that I felt like it was focused on giving those tools.
Yes.
And I really appreciated that, because it's not just, again, you need me or whoever the therapist is
Sure.
to implement this. This is how you can better yourself, because obviously the goal where you all work is going home the best self you can be. That's
Right.
How powerful is that? That's
Right.
really cool. So I know you talked about it in the beginning a little bit, but just to kind of reiterate, what are some of the specific goals that you guys together, when music therapy is working with the program, are working on together? Is it group and individual settings?
It can be a little bit of both, absolutely. We've had some patients that we saw that really responded well to the integration of music in our pain management class, or in our coping skills class, or even in our wellness class. We teach a wellness class as part of a whole course on stroke recovery. And the way that I think what music plays a really powerful role is we're teaching folks how to get healthier, how to integrate better health regimens in their day-to-day life. And we always say, it's important to sleep well and to eat well and to exercise, but how do you make that tangible? And sometimes through using music, we make that tangible. So as you mentioned, like if you're just lifting weights, and sometimes it's not all that fun. But in this session, Trent played along to some great fun Beatles songs, and people kind of forgot that they were exercising and just focused on the fact that they were having fun. So certainly by pulling in music therapy, it helps us to achieve these goals that might feel kind of sterile, if you will, in a medical setting, and just breathe some life into them.
Beautiful. I love the example of that. So you've given us plenty of reasons of why you would refer to music therapy, why that would be appropriate, and I think it's important to just mention quickly that it's not because they like music, right? Sure. Because everybody, I'm sure, if you're 1,900 admissions, did you say?
Yeah.
Everyone likes music, right? Yeah. And he's one person with 25 hours a week. He's pretty great. But So what are some things you're really specifically looking for before you make a referral for music therapy?
Right, and that's something I'm glad you brought that up. That I've learned from you too. Obviously, music therapy is not entertainment. Sometimes there is a value to that where it brings some brevity to the situation.
Sure.
But what I'm looking for our music therapy team to bring to the whole goals for our collectively for our patients are behavioral activation, helping with a patient that perhaps has some problems with motivation, or just doesn't want to get out of bed that day, and we've tried everything. And sometimes bringing in music can really help to promote wakefulness and arousal and so forth. You have done wonders in helping with some of our agitated patients that are recovering from brain injury, that are still in a very delicate stage called post-traumatic amnesia. Sometimes bringing in music is a very powerful modality to reduce that overstimulation. With pain management, bringing music in can help to level out a patient's breathing, can help with relaxation, and provides a very powerful distraction, right? So those are some of the things that...
Best
How
advocate
yep,
ever, right
yep.
here. I'm like, oh my goodness.
And thank you for that.
Yeah.
Oh,
Honestly.
of course. When I heard that they were thinking about developing a music therapy department, I was on board. From day one. At Memorial, one of our slogans is going beyond, and it's not just an advertising slogan. It's really our way of life, that we don't just do the bare minimum of what is expected, but we want to provide every opportunity available to our patients, and music therapy being one of them now. That's really helped to enhance what we do collectively at the Institute.
And everything about the partnership that we've had with you all has just been nothing but so positive and supportive, and everything you're saying is shining through. Yeah, it's, like you said, it's not just an advertisement, which is so incredible. I mean, we're all drawn to this field because we care about people and want to make a difference, want to help, and it's just so comforting when you meet like-minded people to work towards these goals. So again, thank you for that, and thank you so much for coming on the show to talk about that. If anyone has questions or wants to reach out to the hospital or wants to find out more about the department, how can they contact?
We have a website, memorialrehabilitationinstitute.com.
Okay.
That's probably the easiest way to get a hold of us.
Sure.
And we have a lot of social media presence and so forth. So I'd be happy to leave some contact information with you.
Wonderful.
We love giving tours. There's a virtual tour that you can access on our website. But feel free to come visit us in Hollywood anytime. It's a really welcoming, homey environment.
And yeah, like you mentioned, social media, Facebook, you can find Trent here on a few of those media videos, which
Sure.
working with, my gosh, just quickly, if you could talk about one of the highlighted videos of working with, was it
Ralph?
Yeah.
Uh-huh,
You want to just
Ralph.
share really quickly about that?
Yeah, I feel like that video really encapsulated the team effort approach. You got to hear from PT, OT, a little bit from music, even water aerobics. You got to hear from his physicians, the surgeons. You got to hear how each person played a very unique role in helping to recover Ralph and help him find himself to go after his own recovery. It was just, I got to be part of such a unique moment, I think, at the hospital. And so I was just really honored to be part of the video, and that they would shine how music therapy helped him recover his ability to even utilize the coordination of his hands, right, on the djembe. He would tell me a lot of times, he's like, man, I really feel the blood back into my hands. When he came into the unit, he couldn't feel his hands in space at all. He had no real body awareness. And so for him, over a series of a couple of weeks, to go through each day in, day out, 3 hours a day, and then extra things on top of that, to really work towards his goal of being able to, he was a paramedic, right? And so he's a strong guy, strong, big guy. And so just like to work towards those goals and allowing music therapy to help him, in a way he found a connection and he found a passion. He's like, dude, I'm going to totally buy djembe after this. I was like, do it, come back, I'll give you lessons.
Yeah.
But really quick, the coolest thing I feel like from his community that I saw was that people came in and not only visited him, they worked his shifts. So he would still get paid while he was recovering. I just thought, wow. Like, let me learn from that community and bring part of that with me even to music therapy world, or to Memorial. Like, let's just help each other.
I'm so glad you mentioned that.
Isn't that beautiful?
Yeah, that's awesome.
I mean,
Yeah.
this team of guys just loving on this kid, like,
It speaks volumes about him
yeah,
as well.
sure does.
That's amazing. Dr. Thomas, thank you so much again for coming
pleasure.
on
Thank
and sharing
you.
with us, and for all your support and your advocacy. We love you. So thank you so much.
You're welcome.
Stick around. We're going to do a quick commercial break. When we get back, Trent and I are going to close it out with some music. You don't want to miss it. Take care.
Mom's fall was a wake-up call. We knew she needed help, but we also knew she'd never leave her home.
With jobs and kids, we can't always be there. We weren't sure who to trust to help around the house and make sure she takes her medications.
We did our research and found our answer. Bright Star Care. Their home care teams are led by registered nurses, with help available 24/7.
Thanks to Bright Star Care, Mom can stay where she wants to be, at home.
For a standard of care that raises the bar, call 844 for Bright Star.
The Palm Beach Music Therapy Institute is a professional music therapy practice serving medical, community, and educational settings throughout Southeast Florida. With our experienced team of 11 board-certified music therapists, we use music and research-based therapeutic interventions to help individuals of all ages and abilities reach their goals and increase their quality of life. For more information on our services and programs, please visit our website at pbmti.com. Engage with us on Facebook, Twitter, or Instagram, or call us at 561-747-9944. You are listening to Palm Beach Music Therapy Connections. If you'd like to join the conversation, the toll-free number is 888-565 1470. Now back to the show. Hello, thank you so much for joining us. You're listening to and watching Palm Beach Music Therapy Connections. I'm your host, Bree Bynan, and tonight we've been talking to Trent Barrick, board-certified music therapist and certified neurologic music therapist with the Palm Beach Music Therapy Institute, working down in Hollywood, Florida, at the Memorial Regional Institute on the rehab unit. We also got to hear from Dr. Lauren Thomas, neuropsychologist, and not only about the work that she does and how important that is, treating not only the physical needs of the patients on the unit, but also the mental health needs, which, as she's shown a light on, is as important. And not only is she wonderful at what she does, which I'm sure could come across for those who are listening and watch that, but such an advocate for music therapy and bringing Trent into that and just expanding on so many opportunities for those departments to work together. So thankful for both of my guests today. I know I learned a lot. I hope you did as well. And now I'm going to stop talking, and for the rest of our time together today, Trent and I are going to do a little music together, one of my favorite people in the world to sing with. I've been excited about this all week.
I've got this friend, I don't think you know him. He's not much for words, he's hidden his heart away. Oh, I've got this friend, a loveless romantic, and all that he really wants is someone to love him back. Oh, if the right one came, if the right one came along. If the right one came along.
Oh, I've got this friend, I don't think you know her. She sings a simple song that sounds a lot like his. Oh, I've got this friend, holding on to her heart like it's a little secret, like it's all she's got to give. Oh, if the right one came, the right one came along. If the right one came along. It'd be such a shame If they never meet,
she sounds lovely.
he sounds right out of a dream.
If only,
If only,
if only.
if the right one came, the right one came along. I got this friend. If the right one came, the right one came along. I got this friend. If the right one came along. I think we've got time for one more.
All right.
Should we do some Ingrid?
Yeah, let's do it.
If you were falling, then I would catch you. You need a light, I'd find a match, 'cause I love the way you say good morning, and you take me the way I
If you are chilly, here, take my sweater. Your head is aching, I'll make it better. 'Cause I love the way you call me baby, and you take me the way I am. I'd buy you Rogaine
I need it.
if you start losing all your hair. So on patches to all you tear. 'Cause I love you more than I could ever promise, and you take me the way I am. You take me the way I am. You take me the way I am.
Thank you so much for joining us tonight. We'll see you next week on Connections. Thank you for listening to Palm Beach Music Therapy Connections. We hope you enjoyed today's program and discovered new ways to bring music, art, and dance into your home or workplace. Please find a copy of today's show at pbmti.com. If you have any questions for our guest or myself, please email me at Bree, that's BREE, at pbmti.com, or call the Palm Beach Music Therapy Institute at 561-747-9944. Tune back in next week for an all-new live show. See you then.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and